Hi, I'm Bart, Chief Medical Information Officer for UPMC, and today I'd like to talk to you about UPMC's telemedicine transformation during COVID-19. So telemedicine or virtual care comes in many different flavors of both synchronous and asynchronous virtual care. Predominantly what we're going to be talking about is the one in the middle, which is synchronous provider to patient care. And here in Western and Central Pennsylvania, we predominantly use our MyUPMC patient portal, connecting it to our Epic ambulatory electronic health record, although we also do telemedicine utilizing our Cerner acute care record. So in order to deliver telemedicine, you have to actually have a good team assembled. And we were fortunate enough that we were able to have a very strong, stable team of leaders assembled prior to the pandemic starting. Carla Damer oversees our operations team, which really is the team that works most closely with our clinicians in establishing the telemedicine program and projects within each of their specialty and discipline. We have a technology support team led by Scott Foser, who really oversees all of the technology, hardware, and software that our clinicians use to deliver telemedicine care to our patients. Katie Scott oversees our patient portal, which is instrumental in giving sort of one-stop shopping for our patients to be able to access all of their care needs at UPMC, as well as their access to virtual care or telemedicine. In addition, you need revenue cycle support, as many of these instances are reimbursable services, both before the COVID pandemic, during the pandemic, and we hope continuing after the pandemic, as well as the integration into our EHR Epic, which is our ambulatory EHR here in Western and Central Pennsylvania. And then, of course, we have a lot of really high quality support from Terry Lewis on our regulatory and legal issues, which, as you can imagine, through the course of calendar 2020 and the pandemic, we're changing on almost a daily basis. So during the public health emergency or the COVID-19 pandemic, a couple of things occurred very early on in calendar 2020. A couple of things that affected telemedicine billing and reimbursement were in early March, CMS said that all qualified providers can see patients remotely, and that Medicare and Medicaid reimbursement were made available with very minimal requirements. And then this was further supported in mid-March by DHS Secretary Azar, who really broadened Medicare telehealth services and the access to them. And then subsequent to that, the private payers really followed Medicare's lead in improving access and availability to provide telemedicine services that were reimbursable. So we're going to start in the ambulatory environment, which is where we delivered most of our telemedicine services during the pandemic and continuing through to today. And what I want to show you here is that we provide telemedicine utilizing an audio video system by a company called VidYO or Video. And I think, early on in the pandemic, imagine you're in March of 2020 here in the United States. And one of the things you can see is through the weeks of March in the left-hand column next to the dates, the number of clinicians that we provisioned with accounts grew by 150% over the baseline of about 4,100 to about 10,200. The other thing also, if you look at the two right-hand columns, is that the number of processes or two-way sessions that were occurring rapidly grew through the first week of April, as well as the concurrent sessions that were occurring. 10 a.m. each morning was about the busiest time on Monday through Friday here at UPMC, and we were running almost 700 sessions concurrently by 10 a.m. a month after the pandemic really started here in Western Pennsylvania. Starting the video, if you're a patient, is quite easy. And this is a representation of someone who's in our MyUPMC patient portal on their smartphone, and the telemedicine visit is initiated by the patient by clicking the green icon, and that moves them into the begin visit session. And as soon as they click that, they'll be in the virtual waiting room, waiting for their clinician to join them for their telemedicine visit. Over the course of 2020, and this goes from January 2020 until about March 2021, in the purple, you'll see these are the face-to-face visits, and you can see that precipitous drop in the March-April timeframe of 2020. What you'll also see is a concomitant increase in the orange or telemedicine virtual visits across that time frame and continuing through to today. Looking at that in more detail, you can see that we went from about 200 to 250 telemedicine visits per day between clinician and patient prior to the pandemic, and then abruptly went up to over 10,000 ambulatory telemedicine visits on a daily basis. And we continue delivering on average about 4,000, 4,500 telemedicine visits on a daily basis, Monday through Friday here at UPMC. So there was significant growth and sustained growth across that time frame. And of course, you could see the initial peak when our Pennsylvania was essentially under a lockdown. And then you can see this last winter where most of the United States experienced a peak in November, December, January, the same thing occurring here. And as that concern around the presence of COVID cases occurred, there was a concomitant increase in the number of telemedicine visits delivered. I wanted to just hone in on endocrinology because I think that's a specialty here at UPMC that really took to telemedicine very well. And one of the things that's important is in March 2020, they barely had a drop off in the number of visits that were delivered on a monthly basis by our group here. And in fact, they transitioned very seamlessly to nearly 100% telemedicine. And even through today, continue to deliver telemedicine for about 70% of the visits they are giving to patients at this time. If we look at emergency medicine, we have a long history here at UPMC of access to care through our emergency departments. This is our average daily volume of face-to-face visits, excluding a portion of our care in the Pinnacle region of UPMC, but it's been pretty steady. The one thing you'll notice is in the April timeframe of 2020 that there was a pretty significant drop off in the number of patients that were physically seen in our emergency departments. And in fact, we have not recovered on a daily basis to our pre-COVID face-to-face visits in the emergency department. Concomitant with that, we looked at our Anywhere Care program, which are unscheduled virtual care visits between ED, urgent care physicians, and APPs directly to consumers or patients. And you can see that there was a significant increase occurring in that April 2020 timeframe. So we've seen quite a bit of growth in it across the early parts of the pandemic and continuing through the pandemic. The light purple here is nurse visit immunizations that were occurring also during that time period. Critical care was, again, a unique opportunity for UPMC in the pandemic period. We did not have a telemedicine solution that was built for the ICU experience. And as you know, whether it was the experience in New York City early in the pandemic or Seattle early in the pandemic, there was a limited number of ICU beds and also a limited number of ICU clinicians. We didn't know at the time, entering into the pandemic, where UPMC and our hospitals would fall in that. And so we made a decision very early on to collaborate with UPMC Enterprises in building a workflow-driven solution for ICU teleconsultation care. The idea was to connect the clinicians in a collaborative manner that also allowed them to do documentation within the solution to really make it easy to connect our ICU clinicians that we have many, predominantly here in the Allegheny region, out to the other hospitals that UPMC owns and operates. Safford Telecare was constructed in a manner that it required very limited data set of patient information. It could be logged into on a mobile device, laptop or a desktop, and a consultation request could be made by a clinician at the requesting end that would be seen in the screen you see here that has built-in SMS or text message alerting to clinicians who are monitoring this so that they can respond to these consult requests that were coming from all of the hospitals at UPMC. It provided two-way care in chat and video. They were able to document the care, and they were able to do follow-ups utilizing telemedicine. In this case, it was much more of a clinician-to-clinician model, but it was really something that helped us scale the expertise of our intensivists across the healthcare system in a manner that was seamless and very fast. In fact, early on, where we still had a larger number of ICU beds than COVID patients, we actually, during the development of this, were able to test the use of it. So we went from inception of the idea to the development of the tool within 2 weeks. And then, as I mentioned earlier, New York City was sort of a burning platform of challenging, healthcare delivery, limited ICU beds and limited ICU clinicians. We were able to partner with New York Presbyterian, Mount Sinai, and NYC-HHC to allow our intensivists to connect with their clinicians to help facilitate care decisions about the patients requiring ICU services in New York City. And in fact, illustrated here, New York Presbyterian took a full-page ad thanking UPMC, and this was taken out in the Pittsburgh Post-Gazette. So let's just talk a little bit about our telemedicine volumes during 2020. As you can imagine, telemedicine, we had huge growth at UPMC as well as the rest of the country and internationally. Ambulatory, we had about 1.2 million ambulatory telemedicine visits. We also did ambulatory e-consults as well as inpatient e-consults, and you can think of those as HIPAA compliant communication between two clinicians to meet the needs of a patient. We also did telemedicine visits with UPMC senior communities, which were over 20,000. And then the Safford telemedicine solution, or the eICU solution I mentioned, we did over 1,200 consults during 2020. And at the bottom there, you can see all of the hardware that was deployed across both our system, as well as in the support of some of our clinicians who, because they were in isolation but were healthy, were able to deliver care from their homes. And with that, I'd be happy to take any questions that you have at the appropriate time. Thank you for your time today.